Now for the next portion of the presentation, we'll be exploring stories from Sabrina and Julie Beach and Cheryl and Jordan Kyra. This fall, when this event takes place in person, they will be at the University of Vermont to share their stories in person. But today we will be hearing about their stories from documents and information shared directly from them. So this is Sabrina, and this is her mother, Julie. Sabrina is 21 years old, and she has cerebral palsy. Sabrina was diagnosed with cerebral palsy shortly after birth. She experienced seizures and received care in the neonatal intensive care unit. During this time, her parents, Julie and Michael, worked with a vast number of providers working to care for Sabrina. It was a very stressful time for them. There was a lot of confusion, and they received very little support from the providers that they worked with. As Sabrina was younger, most of the providers that her family worked with focused primarily on her CP and emphasized the things that they thought that Sabrina couldn't do, the things that they thought she would never do, all of the negative attributes that they associated with her cerebral palsy. For instance, possible incontinence and overbite, poor dental hygiene, saying that Sabrina would never speak, that she would never walk, all of the things that they saw cerebral palsy as taking away from her. As Sabrina grew older, she proved her early childhood doctors wrong, and she achieved many accomplishments. As this happened, her doctor seemed to have a more positive outlook, saying she can do things, she can speak, she can take steps. Even if this shift in outlook was not due to Sabrina's accomplishments, the Beach family views this shift as Sabrina becoming more human-like. They think that doctors saw Sabrina's accomplishments. They see that the doctors viewed Sabrina's accomplishments as proving her doctors wrong and becoming worthy of their care. And if that was not the doctor's intentions, it doesn't matter, because that's how the patient perceives their care. It's important to see your patients as human beings with potential and a life to live at all stages, not just after they've proven that they can achieve arbitrary milestones that we've set. These are some of Sabrina's tips for success in the clinical setting. The first is talk to me, not my patients. Not my parents. If you don't understand your patient, don't assume what they've said. You can ask your patient to repeat themselves or clarify what you think that they said. I'm sorry. Let me just clarify what I believe you said. Did I hear you correctly when you said this? All of these are ways to maintain that direct line of communication with your patient. Don't look to my parents to communicate with me. That shows the patient that you're not looking to communicate with them. You're going to fall on a safety plan, on someone else to communicate about the patient. You're no longer including the patient in that line of communication. Make sure that offices are wheelchair accessible. Not just the minimum accessibility width. That can leave little room for wheelchair navigation, little room to turn, to move around. Also be sure that there is room in your offices for a wheelchair and an aide or companion who may come with your patients to accompany them to any appointments. Don't make your patients feel guilty if they don't follow your advice exactly. An example of this is a story that Sabrina shared with me. Sabrina's physiatrist recommends standing 2 hours every single day for her leg strength. With Sabrina's schoolwork, job, and clubs at her university that she's involved with, this becomes very impractical. Even with the standing capability of her electric wheelchair, This action relies on others to put in her knee and chest blocks to prevent Sabrina from falling out of her wheelchair, removing independence from her everyday life. Oftentimes, individuals with disabilities work with a multitude of specialists, and each specialist has an idea of what each patient should be doing every single day. Think about what that can mean when you have a specialist offering a plan of action that's impractical in your everyday life, and multiply that times 4 or 5, how overwhelming that can be. If a patient is having trouble following your advice, try to find a balance that can work in their everyday life while still maintaining that therapeutic benefit that you're looking to achieve. This is a quotation from Verna Myers. Verna is an American activist in the civil disability rights movement. She says, "Diversity is being invited to the party. Inclusion is being asked to dance." Next, we're going to learn about Jordan and Cheryl Kyra. This is Jordan. She is 23 years old and she has Down syndrome. And here is her mother, Cheryl. So Cheryl is Jordan's legal guardian. Cheryl acts as an intermediary between the healthcare team and Jordan. They understand that while guardianship may impede the relationship between Jordan and her healthcare team, it's necessary in order to protect Jordan's independence due to her level of cognition. Cheryl explains that Jordan is a very trusting person. So if anybody says, "I think you should do X, Y, or Z," Jordan will agree whether she understands what's happening or not. So it's important that somebody stands between the healthcare team and Jordan to make sure that she understands what's being asked of her. The guardianship that prevents Jordan from interacting directly and giving consent to her healthcare team is meant to protect her. And that isn't always how it's viewed by providers. There are providers who disagree with guardianship, but regardless of how you understand guardianship, it's vital that you respect this relationship. Guardianship is how families can ensure that their loved ones are getting the best care. And if a guardian communicates with you, it's important that you listen to what they say, respect their input, and understand that they have their loved one's best interests at heart. It's also important to understand that all decisions are based on what Jordan wants, but the communication goes through Cheryl. Guardianship does not mean that Cheryl's making decisions. She's just the one communicating with the healthcare team. For Jordan's clinical experiences, most of her medical issues are related to her mouth. She's had multiple surgeries and procedures, and there was one standout experience that was very negative for the Kyra family. During a hospital stay related to a procedure in Jordan's mouth, the nursing staff repeatedly missed shift assessments, refused requests for pain medications, and dismissed Cheryl's expressed concern over the care for Jordan. There was equipment in Jordan's room that was used incorrectly. It produced false readings, inaccurate data, and it took over an hour for anybody on staff to recognize the issue with the equipment in Jordan's room. Ultimately, Jordan's IV access became compromised, and the nursing staff wanted to remove this IV and create another IV access. Cheryl demanded the discharge of her daughter. She determined that the care that Jordan was receiving was no better than the care that Cheryl could provide at home. This occurrence, this type of experience, is not unique. Patients with cognitive disabilities are oftentimes left in clinical situations that put them at risk for negative patient outcomes. It's important to note that after intervening an advocate service, worked with the Kyra family to file a complaint with this hospital, and this nurse was put on administrative leave and she was suspended for 3 days. This is a quote from Cheryl Kyra. She says, if you say your child has a cold, you want them to look at your child like a child with a cold, and then throw Down syndrome in there, or else you'll only ever see Down syndrome. Now, despite the negative experiences that the Kyra family has, there are still some positives that they've experienced. For example, Cheryl says, the nurses at Newton Wellesley Hospital in Newton, Mass. make you feel like you are the only person on their assignment. They make you feel supported, they take the time to show they care, and they step out of the box to help their patients who need unique help. An example of this last one is Jordan needed to walk around the unit for part of her physical therapy, and she was very depressed and didn't want to do that. The nurse brainstormed ways that she could encourage Jordan to walk around the unit and suggested, how about you FaceTime with your friends at school and you take them on a tour of the unit? Jordan was very excited to talk to her friends, and so she took her phone and she walked right around the unit, showing them everything that there was to see around the unit. And by the time she was done, she had a few laps done around the unit, completing her physical therapy assignment, and the nurse had her walking around. But to Jordan, she had just taken her friends on a tour. It's important to connect with patients on their level. And you should always remember that one size does not fit all when we're talking about patient care. You should always be ready to individualize your patient care based on what they need. Some things to keep in mind is that textbooks are not always right. When you're working with a child with a disability, there's always variability. You should be very flexible with your care and find ways to connect with that child individually. You should always view your patients as individuals and not standard case studies. Also, the first mistake that you will make is to assume that you know everything. It's important to admit when you lack the knowledge you need, be comfortable asking for colleague support, and do not be offended when it's pointed out that you do not know everything. Ask specific questions to avoid any misunderstandings. An example of this is one time Jordan went to a doctor for a pain that she felt in her leg when she sat down. She was standing in the doctor's office when the doctor said, "Jordan, does anything hurt you?" And Jordan said no, because while she was standing, her legs didn't hurt. Then the doctor said, "Jordan, when you sit down, does anything hurt you?" And Jordan said, "Yes, when I sit, my legs hurt." Had the doctor not asked that specific question of, "When you sit down, does anything hurt?" then the doctor would have missed that entire medical issue of the pain in her legs, would have missed that entire pain assessment, and Jordan would have continued to have that pain in her legs. It's important to understand potential problems when patients may not understand how to properly advocate for themselves. Additionally, specialists are crucial to understanding complex medical issues for children with disabilities. Primary providers will not understand everything there is to know about disabilities. It's impossible to have a complete understanding of any topic. What it is possible to do is to have the resources available to give to patients and their families so that they can get the best care possible, that specialized care that they require for their loved ones. Now, as this presentation comes to a close, if you take nothing else away from this presentation, I hope you take this away. When in doubt, ask. There will never be a time when anyone's upset that you're asking a question, whether it's about terminology, practices, resources, ways to make your physical space more accessible. Your patients will know best how you can support them. If there's anything that you are unsure of, you should always ask. Before we end, I would like to thank the Beach and Kyra families for their invaluable wealth of knowledge and experiences. Without their time and assistance, this event could never have happened without them. Also, I would like to thank Erica Calero and her support and assistance in the organization of this event. Thank you.